Sounds good.
Well, hello, everyone, and welcome to the 2022 Employee Benefits Open Enrollment Session. My name is Wanda Caldwell, and I am the HR Benefits Manager. Assisting me today is Maria Martin, Benefits Consultant, and Madison Little, who will be serving as our Zoom producer and moderator. We have representatives from our insurance carriers, and some will be presenting, but all will be available for questions that you might have. I'd like to take a minute to introduce them to you. From Blue Cross Blue Shield of North Carolina, we have Ms. Jasmine Walden. From CVS, Ms. Sarah Vaca. From Dental, Cigna Dental, Ms. Beth Barnes. From IMED, Mr. Brian Booth. And from Marathon Health, we have Ms. Jenna Ewing. We have a lot of important information to share with you today, but before we get started, I must inform you that this presentation is being recorded and that it will be saved and available on McWeb within 24 to 48 hours in case you miss any part of the presentation. We want this meeting to be about you. So please feel free to ask questions after each presenter, or if you prefer, put your questions in the chat box. So let's begin. Our topics for today will be the following: changes in 2022. We'll talk about the medical options, dental and vision options, pre-tax options. We'll speak a little bit about the Marathon Health Services and voluntary benefits. We want you to know that your questions are important to us. Please remember these sessions are public and we have a responsibility to protect your personal health information. So I just ask that you can pose your questions in a generic or general form, and please refrain from giving out any personal or private information. If we're unable to answer your questions during this presentation due to time or content, please reach out to the respective insurance carrier or our Employee Services Center at 704-432-6947 for more assistance. So what's changing in 2022? Both of our medical plans, the Preferred Provider Organization, as we refer to sometimes as PPO, and the High Deductible Health Plan with a health savings account are increasing their co-insurance from 25% to 30%. Remember, the co-insurance is the sharing of costs by the insurance and the member. TeleDoc is the new telehealth service provided by Blue Cross Blue Shield. The pharmacy's co-insurance is also increasing from 25% to 30%. The county's contribution to the high deductible health plan for 2022 will be $500 for individual coverage and $1,000 for family coverage. January 1 of 22, IMED will be administering the county's vision coverage. IMED is a new vendor. Currently, we have a partnership with United Healthcare, but come January 1 of 2022, IMED will be our new partner and is in administering the county's vision plans. We are slightly increasing the medical, dental, and vision rates. And with the voluntary benefits, what is known as critical care is changing to critical illness. So the benefit is still the same, it's just the naming of the benefit is changing from critical care to critical illness. So let's talk about our medical plans. Mecklenburg County has two plans that employees can choose from. There's the traditional Preferred Provider Organization, otherwise known as the PPO. And there's the high deductible health plan that has a savings account with it. Sometimes we refer to it as the HDHP plan. There's not a one plan better than the other plan. I'll go into more detail about each of the plans in the next few slides. So what does the high deductible health plan with the health savings account offer? Well, it has a higher deductible, but lower premiums. It has a co-insurance, and it has a health savings account tax advantage savings account plan. The county contributes to the health savings account. Internally, we refer to this contribution as the county's seed. For 2022 plan year, Mecklenburg County will contribute $500 for individual coverage and $1,000 for family coverage. You can also make contributions via payroll deduction up to the IRS maximum limit. The annual maximum limit for 2022 is $3,650 for individual coverage, $7,300 for family coverage. And if you are over the age of 55, you can contribute an additional $1,000. Remember, a health savings account can be used to pay for out-of-pocket medical expenses, prescriptions, co-pays, and the deductible. The nice thing about the health savings account is that you can roll over any unused funds to the next year. Now let's talk about the Preferred Provider Organization, or the PPO plan. If you were hired before January 1 of 2017, you can choose to elect the high deductible health plan or the PPO plan. With the PPO plan, you have a lower deductible, higher premium. You have the option to participate in the healthcare flexible spending account, which is also a tax advantage account. And you have a copay and co-insurance. As I said, flexible spending accounts are tax advantage benefits. At the county, we have a healthcare FSA, a dependent care FSA, a commuter reimbursement FSA. You can only elect the healthcare FSA with a PPO plan, or if you decide to opt out of the county's medical plan altogether, you can participate in the healthcare FSA plan. A few things that you should know about the FSA plans, at least the county's FSA plan. For healthcare, for the healthcare FSA, the funds are front-loaded at the beginning of the year, and your employee contributions are deducted from your paycheck, each payroll. More importantly to remember is that any unused funds in this healthcare flex spending account at the end of the calendar year is forfeited. It is a use it or lose it plan. However, keep in mind, IRS guidelines are subject to change. Dependent care FSA can be used to pay for daycare expenses for dependents under age 13 and elder care. The funds are not front-loaded, and you cannot roll over any unused funds at the end of the plan year. With the Commuter Reimbursement FSA, you can be reimbursed for any expenses related to transit. For example, bus passes, light rail, and van pool expenses. These are subject to rollover and can roll over from year to year. Any questions so far?
Hey, Wanda, we do have one question. Does DCA cover after-school programs?
They do, provided the child is under the age of 13.
That's the only question I have so far.
Okay, very good. All right, so moving on. So now at this point, I'm going to turn it over to Ms. Jasmine Walden from Blue Cross Blue Shield to provide additional information on how to better utilize your Mecklenburg County medical plan. Ms. Jasmine.
Hello.
Hi, Jasmine. Would you like me to stop sharing now?
Yes, ma'am.
Okay.
Okay, Ms. Wanda, are you able to see my screen?
I am. Thank you.
Thank you so much. And good afternoon, everyone. As Ms. Wanda stated, my name is Jasmine Walden. I'm a representative from Blue Cross Blue Shield, North Carolina. And welcome to this presentation about your health benefits offered to you by Mecklenburg County government and Blue Cross and Blue Shield of North Carolina. Today, I want to spend a few minutes highlighting some things you should know how to get the most out of your health plan. You can save money by visiting doctors who are in the Blue Options network. To find out if your doctor is in the Blue Options network of providers, just call us at the number on the back of your health insurance ID card. You can also go to blueconnectnc.com and use our Find a Doctor tool. Anyone can find basic information about our in-network doctors, but if you're looking for more details, you'll want to log in. And on the PowerPoint slide, you would see where it's highlighting the Find a Doctor drug facility tool. That's where you would go if you're looking for basic information. The next highlight will locate the area where you would want to log in with your user ID and password that you have selected to get more detailed information regarding the provider. When you log in, you'll see this homepage. Just click on Find Care to get the information you need. You would notice that Find Care is here in the middle of the screen. As a part of your preventive care services, you can see an in-network nutritionist 10 times per year for no charge. These experts can help you start good food habits, create healthy, budget-friendly meals, and know how to eat if you have a health problem. And again, those visits are covered at 100%. If in network, there are 10, you can see the nutritionist 10 times per year at no charge. And you can get the care you need. You can have your health plan information right in the palm of your hand. Blue Connect Mobile lets you securely connect with your Blue Cross of North Carolina health plan whenever you want. You can get your digital ID card, view your claims, or track your benefits, deductible, and out-of-pocket expenses. You can also call customer service or send a message through the app. There's also a fingerprint Touch ID sign-in, which is available on certain devices, and everything on the mobile app is available in Spanish. Blue Connect Mobile is free for Blue Cross of North Carolina members. It's available on the App Store or Google Play. For support or more information, you can visit bcbsnc.com/mobile. And again, you can get your digital ID card, view your claims, see a summary of your benefits, track your deductibles, call or message customer service. And again, this information is available to you in Spanish. And our Blue 365 program can help you save money while you stay healthy. Blue 365 offers discounts on healthy products and services, everything from gym memberships to nutritional programs to laser eye surgery. When you sign up, you'll get special weekly deals from well-known companies delivered right to your email inbox. From sports gear to personal care, you'll always find healthy savings with Blue 365. Joining is easy. You can visit the Blue 365 website to get started. And with your health plan, you can also chat with a doctor on your smartphone, PC, or tablet. Your health plan includes telehealth services from Teladoc. With telehealth, you visit a doctor without going to a doctor's office. It's a great option if you have a minor health problem or behavioral health problem and can't see your regular doctor. It's often more convenient and often costs less than going to an urgent care center. With telehealth by Teladoc, you can talk to a board-certified doctor by secure online video 24 hours a day, 7 days a week. The whole visit takes place through your Teladoc app or your computer. The doctor can even prescribe medicine and send a prescription to your local pharmacy. If you choose the PPO copay plan, you will pay $25 per Teladoc visit. If you choose the HSA plan, you will pay 30% after you meet your deductible. You may use your HSA card to pay for telehealth visits. Teladoc can handle many non-emergent health problems like these: allergies, asthma, fever, headache, sinus problems, just to name a few. At home, at work, or traveling, you can use Teladoc just about anywhere, any time of day or night. Sometimes life can be too much to handle. Situations like stress at work, changes at home, or the loss of a loved one can make you feel like you've got nowhere to turn, but you do. With Teladoc, you also have access to a licensed mental health professional who can help you deal with stress, depression, anxiety, and much more. Plus, you have the option to choose a telephone or video consult based on your comfort level. You can call Teladoc to make an appointment for a behavioral health consultation. There are two ways to get started with telehealth with Teladoc. Just download the Teladoc app, visit us online, or call us. Go ahead and activate your account after January 1st, so when you need telehealth, you'll be ready. Any of this information that was provided in the presentation, you can also call the open enrollment line for questions. That number is 877-224-3305. For any other service questions, you can call the number on the back of your health insurance card. And again, we're glad that you have the coverage with Blue Cross and Blue Shield of North Carolina. Remember, we're here to help you get the most out of your health insurance plans. If you have questions, please don't hesitate to call us or visit blueconnectnc.com.
Thank you, Jasmine. Are there any questions for Jasmine for Blue Cross Blue Shield?
We do have one question. Is there a contribution from Blue Cross Blue Shield for out-of-network nutritionist?
Read that one more time, Madison.
They wrote, is there a contribution from Blue Cross Blue Shield for out-of-network nutritionist?
So our plan is designed to where we have in-network and out-of-network providers. So based on that provider, if that provider is considered within the Blue Cross network, then the claims will be subject to the county's benefit plan.
Okay. And are we getting new ID cards from Blue Cross Blue Shield?
Maria, keep me honest here. I do not believe we will be receiving Blue Cross cards this year from Blue Cross. Do you recall, Maria? I know that question was asked and I can't remember.
Hi, Wanda. Sorry, I was on mute. Yes, cards will be mailed to their home address.
New cards.
They're gonna get new cards. Yes.
Okay, thank you.
You're welcome.
Wanda, just to add to that regarding the out-of-network providers, with any of the benefits, regardless if it's nutrition or any other provider, it's always better to see a in-network provider as far as cost.
True. And Blue Cross is a national organization, so there's a good chance that the provider is going to be or would be in their network. Any other questions?
I don't see any.
All right. So Jasmine, I believe, did you stop sharing? Let's see.
Yes, ma'am.
Okay. Let me share my screen. Can you all see my screen now? Can you see my screen? Is that thumbs up?
Yes, we can.
Yes, we can see it.
Perfectly. So again, thank you, Jasmine. Now, let's talk about the county's dental plan. Our dental plan is administered by Cigna, and the county still has two types of plans that we offer our employees, a standard and an enhanced plan. The standard plan has a calendar year maximum of $1,000 per individual coverage. There is a $75 deductible for individual coverage and $225 deductible for family coverage. Orthodontic coverage is not available with the standard plan. With the enhanced plan, you have a calendar year maximum of $1,500 for individual coverage, a deductible of $50 for individual, and $150 deductible for family coverage. Orthodontics is covered with the enhanced plan. Just keep in mind that there is a lifetime maximum of $1,500 per individual. At this time, I will turn it over to Ms. Beth Barnes with Cigna to provide additional details regarding the county's dental plans. After she's finished presenting, you'll have an opportunity to ask her questions. So Beth, are you ready?
I am ready.
All right, I will stop sharing.
Perfect. All right, let me share my screen. Okay, so good afternoon, everyone. So thank you for joining today's call. I'm actually going to spend a few minutes going over how to locate an in-network dentist and some other programs and services that's available to you today and going forward through Mecklenburg County's dental plan through Cigna. With Mecklenburg County's dental plans, you can choose to see a dentist that is in Cigna's network or not. You have the freedom to choose. However, if you choose to see a dentist that is in Cigna's network, you can save money for your dental services. To locate a dentist in the Cigna's network, you can search for a dentist in multiple ways. The first way is if you do not have dental coverage through the county today, you can search online at Cigna.com to find a Cigna dentist. We do have a nationwide network of Cigna dentists. Or number two, if you do have Cigna dental coverage today, you can access our member portal through mycigna.com or the MyCigna mobile app to locate an in-network dentist. Good news is that 90% of the county's population is already using MyCigna. So I'm hoping that most of you that are attending today's presentation is familiar in using our portal. Our third and final way, you can give us a call customer service at 1-800-CIGNA24 when you need us. We're on the clock for you 24/7, 365, including weekends and holidays. Estimating your dental care costs. MyCigna also offers convenient tools to help you estimate, plan, and budget your dental care cost. You'll find cost estimates for dental treatments and procedures based on your plan information and dentist contracted fees. And you'll be able to compare what it costs when you visit an in-network dentist versus an out-of-network dentist. You can access that through mycigna.com or the MyCigna mobile app. Cigna's Dental Oral Health Integration Program, you may hear it called as OHIP. The Cigna Dental Oral Health Integration Program is a program that reimburses out-of-pocket costs for specific dental services used to treat or help prevent gum disease and tooth decay. The program is for people with certain medical conditions such as heart disease, stroke, maternity, chronic kidney disease, organ transplants, lupus, rheumatoid arthritis, just to name a few. Again, this program is for people with certain medical conditions with a higher risk of oral health issues. With the Dental Oral Health Integration Program, there is no additional cost for this program. And if you qualify, you get reimbursed for out-of-pocket costs for certain dental procedures. Cigna Dental Virtual Care. While we recommend that you contact your dentist first to see if they can provide virtual care, we recognize that this may not always be possible. Teledentist connects you with a licensed dentist who, through a video call, can help address urgent dental situations like toothaches, infection, swelling, bleeding, and more. They can also prescribe medication to be filled at your local pharmacy if necessary, and virtual care consults are processed as in-network claims and have no copay or co-insurance costs, but it does apply to the county's plan annual maximum. To access the Cigna Dental Virtual Care, you can access it through mycigna.com. And to round things out is Cigna's Healthy Rewards Program. Cigna Dental members have access to discounts on a full range of health and wellness programs and services not covered by traditional insurance plans. Programs include weight and nutrition management, fitness, tobacco cessation, vision and hearing care, vitamins, health and wellness products, anti-cavity products, financial planning, and healthy lifestyle products. To access Healthy Rewards, simply visit mycigna.com or the MyCigna mobile app. Is there any dental questions that you guys have about the dental plans that the county offers?
One question just came in. Let's see. Does the 1,500 orthodontics cover adults?
Just dependent children only up to the age of 19. So if you are looking for adult orthodontics, you could potentially use some of the Healthy Rewards programs. If you're enrolled in the HSA plan, you can use your HSA dollars to pay for adult orthodontics, or if you're enrolled in a flexible spending account, you can use your FSA dollars to pay for adult orthodontics as well.
That's the only question I had in the chat.
All right, let me stop sharing.
Thank you, Beth.
You're welcome.
So back to me. Give me a second. All right. So, as I mentioned earlier, we are switching vision carriers. Currently, we're with United Healthcare for our eye care. But January 1 of 2022, we will be with a new partner, IMED. The county will continue to offer two plans as it does today, a standard and an enhanced plan. Both plans have a copay to an in-network provider and $180 frame allowance. Although both plans are similar, there are some differences. So I'm going to turn it over to Mr. Brian Booth from IMED to share additional information regarding the county's vision plans. After he's done, you'll have an opportunity to ask him questions about the county's vision plan. Brian, are you ready?
I'm ready. If you stop sharing, I'll try to share mine.
Thank you.
Let me try that again. There we go. Can you see my screen?
We can. You want to put it in presentation mode?
Yes, I do. Okay, how does that look?
Good, looks great.
All right, great. Well, thank you again for the time. Again, my name is Brian from IMED. Let's first talk about the need for vision benefits in general. I think some folks, when it comes time to enrolling for vision, you may think, well, I don't wear glasses today. I don't have any vision problems. No need to sign up for vision care, but there are lots of benefits that are available, whether you think you need a vision care or not. So let me start off with a little video here to get us going.
Should you enroll in vision benefits? Grandma might say, if it ain't broke, don't fix it. We love Grandma, but even age-old wisdom like this could use an update. With IMED, good things come to those who don't wait. Vision benefits help pay for eye exams, something every pair of eyes could use, even if you don't think you need glasses. An apple a day may keep the doctor away, but an eye exam each year can help spot signs of diabetes, high blood pressure, and other health problems. Unlike what you've heard, you can always get what you want. With IMED, you can choose any frame or brand, and your favorite doctor is probably already in our network. When you enroll in IMED, a penny saved is several dollars earned. Member discounts and savings on vision-related products and services like LASIK give you more buying power. So in this case, less really is more. We believe nothing worthwhile is easy, except using IMED. We'll hook you up with everything you need: a cost estimator, provider locator, members app, and more. You won't even have to file a claim when you see an in-network doctor. We do it for you. That's right. No pain, lots of gain. There's a lot of wisdom in having vision benefits. So check yes for IMED and experience these benefits for yourself. After all, seeing is believing.
Okay, let's jump into it now. First of all, the value of your vision plan has two different components. First is the value component, which is a function of the financial savings that you'll have available. So there'll be savings on the eyeglasses as well as your eye exams to the tune of about 71% off of retail pricing. So there's some great advantages there. We're going to have lots of providers to choose from. I've got some information that'll talk a little bit more detail about that. And then giving members some additional discounts above and beyond the standard level of benefits. We'll talk further about that. On the wellness side, as you just saw from that video, there's lots of serious chronic conditions that can be detected through a routine eye exam. So that's alone is a good reason to purchase the vision plan, just to make sure you can identify anything early if there are some chronic conditions in your health system. We also want to make sure we're doing everything to protect your eyes and want to make it certainly make it easy to find an eye doctor and manage claims throughout that process. So let's talk about the plan designs itself. There's two different plans to choose from. There's the standard vision plan and the enhanced plan. On the standard plan, you'll see here that a comprehensive eye exam is covered every 12 months, and it's covered with a $0 copay. So really no barrier to entry there. Everybody has an opportunity to get a free eye exam. Then when we talk about materials, it's really three different buckets. There's the frame allowance, where you have a $180 frame allowance that applies every 24 months or every other year, if you will. The lenses, there's a $20 lens copay plus fixed pricing or copays on various lens options. And those are available every 12 months. And then there's the contact lens benefit that includes a contact lens allowance of $150, as well as the fit and follow-up exam for contact lenses that are available every 12 months. And we'll talk about that later as well. So that's the standard plan. If you look at the enhanced plan, it's very similar. The only difference is really on the materials. And that is, instead of having a $20 copay, there's a $0 lens copay. And then there's lots of fully covered lens options, including some of the more costly premium progressive lenses as well. So lots of those are covered in full as opposed to having a copay apply. So that's really the main difference. There's some really savings there as part of that enhanced plan because of that, taking advantage of those fully covered items. So once you take a look at those and you decide which plan is most appropriate, some of the questions that might come up are, what are the frequency and what is the frequency of services and what is that based on? So basically it's a plan year, or in your case, a calendar year benefit cycle. So you do not have to wait a full 12 months from your last date of service to use your vision benefits again. Instead, you can use your benefits at the start of the new plan year or the new calendar year. So again, you don't have to wait that entire full 12 months. Now, it's a nice feature that's happening now with the change from UHC over to iMed, because at this time, it doesn't matter if you purchased your glasses or used your frame allowance in this current year that you're in. Once we start with iMed on 1/1, those benefits will reset and everybody has that full opportunity to use their benefits again, starting brand new on January 1st. So that's a nice feature there. Also, we have this contacts are in lieu of lenses. So I just want to make sure that you understand what that means. It means you're entitled to a full pair of glasses, meaning the frame and lenses, or contacts and frames on every benefit plan year. I just want to remind you that the frame frequency is every other plan year, so keep that in mind. But the good way to think about this is you're covered, you can get lenses, either contacts that go on your eye, you sit right on your eye, or lenses that go into the frames. You get one or the other, and that's how that comes into play. So just want to remind you of that. In terms of the network itself, we have lots of options for you to choose from. The key part is the name of our network is called Insight. So you'll want to look at iMed's Insight network when you're trying to search for providers. We've got over 800 different providers at 187 different locations just in the greater Charlotte area alone. You can see what that's comprised of, both independent providers as well as some national retailers like LensCrafters, Pearl Vision, Target Optical. I will throw in Walmart and Sam's Club are also in there. They're not referenced here on this slide, but please realize that they're part of the network as well. And then there's local retailers that you might find, like in My Eye Doctor, America's Best, Clarkson Eye Care as well, that are in the network. Those of you that like to purchase materials online, We've got 5 different online, in-network online options for you. LensCrafters.com, TargetOptical.com, Ray-Ban.com, Glasses.com, and ContactsDirect.com. So nice provider options are available for you. When you're trying to find the right eye doctor for you, there's a great provider locator available to you. And I mentioned earlier, you want to choose the Insight Network, but you can find that on imed.com. You can also have this available to you on your mobile app or your member portal, so you can download the app and then have the ability to search for providers right there in your handheld. And we also will be sending out welcome kits to every member's home. Once you do enroll, it'll include 2 ID cards and a summary of the benefits, as well as the 4 closest retail providers and 4 closest independent providers to your home address. So that's a really nice feature there. If you're looking to find the closest providers available to you, it'll also provide you with some wellness tips to look at as well. I mentioned earlier, there's some additional savings that you'll want to make sure you take advantage of. These happen to be some of the ones that I've illustrated here that are most common. 40% off an additional pair of glasses. If you want a second, third, or fourth pair of glasses, you've already utilized your benefit, you'll get a 40% off the additional pair. 15% off LASIK prices. We've got 20% off the balance of a frame overage, 15% off conventional contact lenses, 20% off any non-covered items. So pretty much anything vision that's not covered under the plan, you'll still get a 20% discount. And we also offer a discount on hearing exams and hearing aids. So you'll want to take advantage of that if that applies as well. And then lastly, this just shows you that we've got lots of member tools available for you. Again, whether you take advantage of those on the member app or the member web, gives you the opportunity to view your benefits and eligibility. You can find those doctors. You can look at the special offers and discounts that I mentioned. Think of those kind of as Groupons, if you will. You get to apply those on top of your regular benefits. So you want to take those coupon codes to your providers if any of those apply to what you're looking to buy. You can actually load and save your prescription on the mobile app, set exam reminders for the contact lens reminders when it's time to change your contacts. So lots of good capabilities there on your member tools. So with that, that concludes the vision plan discussion. Any questions at all on that?
I don't have any in the chat. Oh, let's see, one came in. I have my eye exam with new glasses coming up in December. Will the standard option cover any vision issues beyond glasses for the year of 2022?
So the way it works, they're kind of separate, if you will. They're not tied together. So if you get the exam in December and you want to purchase glasses come the next year, you can certainly do that and still have the ability to utilize that exam benefit again come next year. So they're not tied together. If you get an exam now, you'll still be able to utilize your materials segment come next year. Does that help answer that one? I think that was the question.
Yes, I think it did. I don't have any further questions in the chat.
Okay.
All right. Thank you, Brian. All right, so let's continue. All right, so let's talk about Marathon Health. Marathon Health is an independent provider of primary care clinics. They have several near-site locations and offer services such as primary care, biometric screening, chronic condition treatment, lab work, and personal health and coaching, just to name a few. Most of you are probably already familiar with Marathon Health, but then again, there may be some of you that are not. So at this time, I'm going to turn it over to Ms. Jenna Ewing with Marathon Health to share with you additional information that's very helpful to know. Jenna?
Thanks, Wanda. Good afternoon, everybody. As Wanda mentioned, my name is Jenna Ewing. I am the client advocate with Marathon Health. here in the Charlotte market. So what I have prepared for you all is a pre-recorded video, which just kind of gives you a high-level overview of our health centers and what we can do for you and your family members that are on Mecklenburg's benefit plan. If you have any questions, feel free to plug them into the chat. Because it is recorded, I'll try to answer as we go. And if there's anything that is personal or might have some PHI in it, or if it's anything related to your personal health, you can always call our member relations team and just ask to be connected to myself that can answer, or one of our clinicians as well. Historically, you may have known us as Our Health. We are the same entity, just with a new name that happened in 2020. So that service is still available to you in this upcoming year, which we're excited about. So I will go ahead and share my screen and play this video. It's about 8 minutes long. But as I mentioned, if you had questions, go ahead and feel free to put it in the chat and I can hopefully answer as we go. My name is Jenna Ewing, and I am the client advocate with Marathon Health in the Charlotte network. The purpose of this presentation is to give you a better understanding of who Marathon Health is and how we can help serve you and your family. Marathon Health is a primary care physician's office with 6 health center locations in the Charlotte metro area. Our 6 health centers range in hours from 7 a.m. till 7 p.m. All of our centers are by appointment only to reduce wait times. We see members on the benefits plan in your family ages 3 and up, so that includes your spouse or dependents. The 6 health centers are located around the 485 loop in Charlotte. Our newest health center location we opened in Matthews, North Carolina in March of 2020. As mentioned before, all of our health centers operate Monday through Friday, with the exception of our North Lake location, open on Saturdays from 8 a.m. till 12 p.m. You have access to all 6 of these health centers. So should you want to get labs done at one of our health center locations, but see a provider at another, you may go to any of the 6 health centers included in this network. The design of this model was so you could have access to care close to home and work. This here is a service overview. The purpose of this slide is to give you a better understanding of what Marathon Health can do for you and your family. We operate as a primary care physician's office, and what that means is we can do your annual routine physicals if you are 16 and up. We can treat you for acute and preventive needs, so if you get sick or if you would like your chronic disease managed with us. That includes high blood pressure, diabetes, thyroid issues. We also have a dedicated referral team that can help connect you with somebody in network if it's something that we can't handle at the health center level, such as a sleep study or dermatological referral. We do see children aged 3 and up on the medical plan. We see children for acute needs, such as cuts, bumps, bruises, sprains, or if they're sick and have an ear infection. The one caveat to that is we see children for camp and sports physicals. Our wellness services that are included with your Marathon Health access is health coaching and behavioral health needs. All behavioral health services as well as health coaching services are free at no cost to you. This can be one-on-one health coaching or group wellness programming. We have an on-site laboratory at each of our 6 health center locations. Labs are free at no cost to the patient. We also have an on-site dispensary and a home med pharmacy. The on-site dispensary is used for acute medications when you are sick or need something at the time of the appointment. Our home med delivery service is where we leverage this pharmacy for chronic care medications, such as thyroid medications or blood pressure medications. In 2020, due to the COVID-19 pandemic, Marathon Health transitioned their model of care to not only being telephonic and in-person, but launched virtual care. As a patient of Marathon Health, you now have access to our providers virtually, telephonically, or in person. The fifth mark on this slide is Marathon Health Portal. The portal is where you can communicate with our ambassadors, our clinical team members. You can schedule appointments as well as access test and lab results. The way that our model is set up is by appointment only, and those appointments are either 40 minutes, 30 minutes, or 20-minute appointment types. The 40-minute appointments are typically for new patients to establish care. This also is included in our annual physicals. A 30-minute appointment is going to be if you are a sick patient and it's a little bit more complex, or if you're new and not feeling well. The 20-minute appointment is for routine care for established patients. So for those that are established with us, we know your medical history, your current medication regimen, and you're just not feeling good, or if it's just a check-in on your chronic care management where a quick set of labs are needed and just to touch base with one of our providers on how you're doing. As I mentioned before, we do have medications on site as well as a home med delivery system. We encourage patients that do not have a primary care or a provider that they see in the network to leverage Marathon Health as their primary care of choice. We can not only manage the current medications that you're on, but do routine lab work and your annual physical for preventive reasons at no cost to you, regardless of the plan that you're on. All preventive services are free. We do have an on-site laboratory at our 6 health center locations. Those labs are at no cost to you and anybody that is on the plan. Sometimes we have patients that have an established primary care in the network, and we encourage that. We're not here to replace your primary care if you have one, but we are here to be one if you need one. We sometimes have patients that use us strictly for our labs only. Let's just say that you have a specialty doctor such as a cardiologist, and you have to get labs every 3 to 6 months. You can have that specialty doctor fax Marathon Health that lab order, and we can draw those labs for you on that specific cadence. We would then send the results of those labs back to your specialty doctor, and there would be no fee for you as the patient. As I mentioned before, we do have a dedicated referral team to the Marathon Health Charlotte network. What this means is if you were to come see one of our providers and you were having issues with sleep, or you had a mammogram up or colonoscopy that was due, or let's just say your child fell at school and you're uncertain if they need an x-ray or not, you can schedule an appointment with one of our Marathon Health providers that can assess the current situation and the need for the referral, and they would connect you with our referral team. Our referral team will take your medical insurance, put it through our system, and reach out to you within a 24 to 48 hour timeline, depending on the need. They would then schedule that appointment for you and follow up with the results to take the heavy lifting off the patient. Health coaching and behavioral health services are a part of the Marathon Health benefit. We have 3 dedicated health coaches in the Charlotte network that consist of a certified diabetic educator that is a registered dietitian, an exercise physiologist, and a CHES certified health coach that is passionate about spiritual and behavioral health. We also have a team of 4 behavioral health clinicians, varying from licensed professional counselors to licensed clinical social workers. All health coaching and behavioral health appointments are free at no cost to the member. So how do I schedule an appointment with Marathon Health? You can call our centralized scheduling team, our member relations team, Monday through Friday, 7 a.m. till 5 p.m. or Saturday mornings. They can help set up an appointment for you. You can scan the QR code below. You also can register online at member.ourhealth.org and create a profile where you can go into the member portal and self-schedule an appointment that way. We appreciate your time in listening to our presentation. If at any point you have any questions about Marathon Health and what we can do for you and your family, feel free to reach out to our member relations team or go to marathonhealth.com and visit us. Check us out. Thank you for your time and have a great day. Thanks, everybody. Wanda, I know there was a couple questions over on the right. I'm not sure if all are following the chat, but some that came up that were good. And just to kind of reiterate, right now we do have flu vaccines in our health centers. So if you haven't gotten your flu vaccine yet, we do have them. If you look at our portal to self-schedule, it says for 4 and up. That was the dosage that we had last year. We're hopefully getting that removed this week. It is actually for 3 and up. Free at no cost to you, so you can self-schedule online. You can call member relations. Another question was around COVID-19 testing and vaccinations. We do COVID testing, but it's for symptomatic patients only at 3 of our health centers. You do have to have a provider visit prior to getting an order written for that COVID test. So typically you'll get screened virtually or telephonically by one of our providers. And if they feel a COVID test is warranted, we have both PCR and rapid. We are not doing return to work testing at this time, only because due to testing supplies, they're limited right now, and just our resources, because we are only 6 health centers in the Charlotte market. Another question that came through was around if you were to need a primary care through Marathon Health, could you see the same provider? And the answer is yes. All of our providers typically stay and work out of one location. We do have a couple that may fill in here or there, especially over the summer where people are taking time off for vacations, but primarily our providers work out of one location. So your primary care you would see would be at Northlake or downtown, or whichever location you would want to see them at. Part of that question also asked about, let's just say you had to go to the hospital for a specific reason, or even to add on to that or layer on to that, if you needed a referral outside of Marathon, something we couldn't handle at our clinic level. Because we're not affiliated with any of the larger entities here, like a Novant or an Atrium, we would ask you as kind of patient if you had a preference, but also we would work with your insurance, so Blue Cross Blue Shield, to ensure that you are being seen by kind of a tier 1 provider, so high quality and low cost. And that's where our referral team would come into play, as well as our providers that we have that work for Marathon are pretty well established in the Charlotte market. So they have a number of providers they would call within their panel that they refer out to. So no limitations there. I'm trying to think of what else. There was a lab question. If there's like a list of labs that you could get done at Marathon. In general, we'll draw all primary care type labs and recommended specialty labs as mentioned in the presentation. When in doubt, we always say just fax your labs over to Marathon Health and just specify which health center you want to get them drawn at. Typically, our nursing staff will then reach out to you as the patient and get you scheduled for a visit, which you would just come in and have those labs drawn. On the rare occasion, there are some labs that are very costly, and it would be cheaper for you and for Mecklenburg County to have them run through your insurance. So we would let you know that prior to drawing the lab. But for the most part, we would say do these labs and we would draw them for you if it were for an outside provider, not a Marathon Health provider. And then we would fax those off to the provider that wrote the order. Our phone numbers, we do have a couple different phone numbers. Our Health used to have an 866 number. We still have that number. So if that's the number you use, you can still use it. There's also a more local 988. On our website, you see any number that you dial will go directly to our member relations team, which is a centralized number. It'll get you where you need to be, whether that's talking to a clinical staff member, or if you just want to schedule an appointment, or if you're logged out or locked out of our portal and you need some assistance there, whether that was to check incentive status or look at recent labs, that's all in your portal. Trying to see if there's anything else I missed. Somebody said that they have the best PCP in Charlotte through Marathon. That's awesome to hear. I think our providers are great. I see them as somebody that works for Marathon. If you didn't get an opportunity or you don't want to ask your question in the chat, totally understand. As I mentioned before, you can always just call our member relations team and have them direct your questions to me or follow up with Wanda or Maria, and they can connect you to me as well. But I appreciate and thanks. I hope you all have a great day.
Thank you, Jenna. Great information, great participation. I really appreciate all the questions. And like Jenna said, if you guys think of any questions after today's session, you can always send them our way to me and Maria, or Maria. All right, so we're gonna move along here. Now let's talk about the county's supplemental benefits, or as some might refer to as voluntary benefits. Well, let me back up. Can you guys see my screen okay?
Yes.
All right, great. Mecklenburg County offer employees cancer, accident, medical bridge, and critical illness, as well as pet insurance. These are considered our voluntary benefits, and they are administered through a third-party broker called Pierce Group. The benefits are 100% employee contributed. They pay in addition to your insurance, should you qualify, and or paid directly to you. Benefits are portable and they're pre-tax with the exception of nationwide pet insurance. That is post-tax. Unlike the core benefits, coverage will remain the same unless you have a change to your coverage. So if you currently have these benefits in place and you don't want to make a change, you don't have to do anything. This slide is a reminder that open enrollment is November 8th through November 19th. If you do not enroll or you want to waive coverage in the medical, dental, vision plan, you must do this during that time, during that 2-week period. If you do not, you will not have coverage for the plan year 2022. So I'm just going to pause there for a second, let that sink in. Please enroll, because if you do not enroll or waive, you won't have coverage for the upcoming plan year. To complete the benefit election, it's a simple, very simple 4 steps that you see on the slide. You log into MyHR, go to Employee Self-Service, click on the benefits tile, and click on Benefits Enrollment, and then follow the subsequent steps. To enroll in the voluntary benefits here that you see on the slide, you need to go to Pierce Group website for the critical cancer, medical bridge, or accident policy. For pet insurance, you would need to go to Nationwide website. Both are listed on this slide. And another good thing to remember is this is a great opportunity. It's a great opportunity to enroll or update the deferred compensation plan. So if you have a 401k, 457 or NC 529 plan, this is a good opportunity to take a look at it and see if you want to make any changes or adjustments to it. You're not required to do it during open enrollment. It's just a good time. These you can make changes anytime during the year. All right, this is what I'm really excited about. To increase employee engagement during the open enrollment period, we are excited to announce that this year we will have an open enrollment raffle. Those of you that complete your enrollment during that period will have the opportunity to be entered into multiple raffles for a chance to win some really great prizes. The prizes will be drawn on Wednesday and Friday during the 2-week enrollment period. The first drawing will be held on November the 10th, and we will announce 20 winners. And as you can see on the slides, multiple winners are slated to be drawn at the designated time. Only those that complete their enrollment by midnight the day before the drawing will be entered in the drawing. Listed here are the resources from today's presentation. A lot of information has been shared today, and we know you're probably going to have additional questions. Here are the numbers and web address so that you can reach out should you have any more questions. And don't worry, in your open enrollment guide that has been mailed to your home address, the resources are also listed in it. So you should be expecting an open enrollment through the US postal system with the open enrollment information, a lot of what you heard today and some. So just stay tuned. You should get that in the mail. And but for some reason you need it before you get it, the information will also be posted on MacWeb. So before I let you go, excuse me. We have one more presentation to make. It is Work Green. So we have with us today, Aaron from the Work Green Initiative to talk with you a little bit about what's going on with the Work Green Initiative. Aaron, are you on? Are you ready?
I am. Hey, Wanda, how are you?
Hey, I'm good. So you ready for me to stop sharing?
Yes, ma'am.
It's all
Okay.
yours.
Perfect. Thank you. All right. So I know that you guys have gotten a lot of information, but I promise that we're almost finished. I'm here to talk about Work Green, which is a fantastic benefit the county offers. But show of hands, it could be a real hand or an emoji hand. How many people have participated in Work Green before or know about the program? All right, awesome. So as a refresher, Work Green is Mecklenburg County's environmentally focused engagement and award program. In 2004, the BOCC passed the environmental leadership policy. And in March of this year, the BOCC passed the environmental leadership policy and action plan. It's an updated version. In the updated version, we state that the county is committed to providing employees with opportunities and incentives nope, it's been a long day, sorry, provides employees with opportunities and incentives to practice environmentally sound behaviors. And so to register and participate in Work Green, you have to visit our Work Green site, which I'm actually going to walk you guys through briefly. But I do want you all to take note of this logo down here. This is our kind of brand for Work Green. You can find it directly on the MacWeb SharePoint homepage. So Work Green works as time off award credits can be earned while on the job or outside of work. Well, how do you get credits, you say? My computer, I hope, is not frozen. It might, oh, no. Yes, there we go. So credits can be earned by participating in webinars and courses that are focused on the environment and are housed in Mac Talent. I'll show you all what those exist as well. Participating in-person activities, such as stream cleanups, and taking part in environmentally friendly activities in your office, such as a green team. Show of hands, real or emoji. Does anyone have or participate in a green team in their office? Anyone? I don't. Awesome. Great. Fantastic. So as I mentioned before, credits earned equate hours of paid time off. 10 earned credits equate 4 hours of PTO, and 20 earned credits equate 8 hours of PTO. My computer is like, so okay. Credits can also be earned by commuting to work by alternative transportation, such as bike, bus, light rail, walking, or carpooling. Volunteering with local environmentally focused groups. So that's not just, we have a list of just groups and events that we kind of promote within the Work Green program, but that list is not exhaustive. So I'll show you that list in just a second. And watching environmentally focused documentaries online. And as I mentioned, 10 earned credits equate 4 hours of PTO, and 20 earned credits equate 8 hours of PTO. So I'm going to stop with this brief presentation, and I'm going to go, if my computer will let me. Okay. All right. Can everyone see my screen? Great.
Yeah.
So we're at a SharePoint homepage. You all are familiar with this. If you scroll down to nearly the bottom of the page, we have that Work Green icon I spoke about. We click on that. that takes us to the Work Green homepage. And so we've got, it's a pretty basic page. We have a program overview, find activities, and log and track credits. So first, I'm going to take you all to find activities. I just updated this since this morning. So the ladies that were on the call this morning, we have more information, which is fun. As I mentioned, we have a list of events that we promote. A lot of these events that are right here, these opportunities that are in person, tend to be either promoted by our internal departments or put on by internal departments. Could be Park and Rec, could be green teams, what have you. And those change and ebb and flow with time. We have some past events listed here. And then we have our documentary series for FY22, and we have both open source, which is free to you as long as you have the internet, and a paid service for those of you that do subscribe to various paid services. And so you can watch any of these and attain, 1 point per documentary watch. And so we're committed to ensuring that, because we're in these COVID times, we don't want people to feel uncomfortable, like having to go out and clean up a stream and earn credit, or go out and pick up some leaves with strangers and maybe be exposed to the virus. So we as an initiative are committed to giving folks opportunities to earn those 20 hours of 20 credits, for 8 hours of PTO via online methods this fiscal year. I also want to show you guys how to log your credits. So I'm going to go back once. We're back on the Work Green homepage, which is pulled straight from SharePoint. We have this log and track credits link, which you click on. And then we're going to click again to log and track credits. And this takes us to a Qualtrics form. So this is the space where you have to track every single thing that you do, be it come to work by a bike, be it watch a documentary, be it volunteer at some sort of like beekeeping event. You have to log that information here, because this form is how we track all the credits that each person gets during the course of a fiscal year that equates to that paid time off. So this is crucial to getting that benefit. If you fill it out, please use your right email address. We have some confusion sometimes. So if you could just use your county specific email address, that'd be great. And then you can click on whichever opportunity you participated in, and each one of these will take you to a different section of the survey that allows you to kind of fill out more details as to what the event was, what the documentary was that you watched, et cetera, et cetera. I'm going to stop share real quick so I can grab a tab, and I'm going to reshare one more thing, and then I'll stop talking. So if you head to Mech Talent, which I do have open, I'm going to share one more time. Thank you guys for allowing the weird sharedness to happen. So we're in Mech Talent now, which I'm sure everyone's aware of. I really hope it works this time. It wouldn't populate last time. So this is the space where we have all of our professional development opportunities and trainings and modules that exist for county employees. If you search for training, hopefully it'll load. It's not going to. Well, normally when I'm not sharing my screen via Zoom, this will populate as to all the different modules that are there, and you can filter the modules by sustainability series. Right now we have 6 modules that are up. We're hoping to have at least 15 by the end of this month, fingers crossed, but I'm not in full, I'm in control of the content, but not the putting it online. So hopefully in a month or so, we'll have enough opportunities for folks to be able to get all of their credits 100% online. Any questions I can answer about Work Green?
Let's see, we do have one in the chat. If we work in Park and Rec and some of these things overlap with our normal job, what can we or can't we log for Work Green credit?
So I would say that it's a great question. I would say anything that is outside of your day-to-day operations. So if there's a green team that's within the Park and Rec department and you volunteer with them, that's a way to get credit. You can take as many modules or as many documentaries or watch as many documentaries as you'd like to get those credits. in terms of like for me, I work in sustainability, so it's difficult for me to be able to log my day-to-day happenings. If I'm like what I'm doing right now, giving you all a presentation about work green, I can't say this is a credit because this is part of my job. But if whatever you're volunteering for or contributing to is outside of your normal job opportunities or job operations, that gets you a credit. But if that's not specific enough, I'm happy to chat offline with that person. Any other questions I can answer?
Let's see, our next question, are 20 credits the max per year?
No, you can take as many credits as you'd like, but we can only award you 8 hours of paid time off. So 20 credits equate 8 hours.
Believe that's it.
Awesome. Thanks, you guys. Appreciate it.
Thank you, Erin.
Thank you.
So that concludes our presentation. I would like to encourage each and every one of you to visit McWeb. Take a look at our virtual benefits fair. It is a great tool and provides good information to make sure that you are making the right choice for the 2022 plan year. And with that, are there any final questions?
Let's see. I don't see, I have one additional question. I think I can answer that offline. So I think we're good.
All right. Well, again, thank you for joining, and I appreciate everyone's time and participation in today's session. Have a great afternoon, and if you have any questions, feel free to call the Employee Services Center or check your open enrollment guide. Thank you all. Bye-bye.